What's my experience been like coming off hormonal treatment? Well, I think I've explained previously that being on menopausal hormone therapy, most of the better options that we have in our modern arsenal don't actually significantly increase your risk of developing breast cancer, which is great. However, we all have such a high background risk of developing breast cancer anyway. I always tell my patients to be very vigilant with their screening activities, because if you develop a cancer, breast cancers are notoriously hormone sensitive, and if you continue to take your hormonal treatment, then you can accelerate the cancer. So, of course, the moment that I got my diagnosis 3 weeks ago, what did I do? Ripped off the patch. I also have a Mirena IUD, which delivers a synthetic form of progesterone known as progestins to the lining of the uterus, because when you're on estrogen treatment, it can thicken up the lining of the uterus. So the Mirena does the job of keeping it nice and thin and stable so that you don't bleed and you don't develop endometrial cancer. So it's called combination MHT, or combination hormonal treatment. So I was on the estrogen patch, had the Mirena, got my diagnosis, ripped off my patch. Less than 24 hours later, cracking migraine and feeling like rubbish. So I thought, okay, maybe I'm putting myself through some unnecessary pain here, and really, for what? I mean, I know I have to come off the hormonal treatment, but doing it really rapidly like that is probably not going to confer any advantage in the long term, especially when I'm having the cancer out in a few weeks. So I thought maybe I need to take a gentler approach here. So I've been cutting my patch in half, and then cutting it down smaller and smaller. And then I made the decision last week to actually try a completely different approach. So you've got estrogen receptors all over your whole body, and it's the estrogen in the hormonal treatment that we use that helps you to feel better by triggering those receptors on the different cells in your brain and your vaginal tissues and all over your body, muscles and bones and all over. So, if you can get that effect without actually using estrogen, then there might be some benefit in not stimulating the breast tissue estrogen receptors. So there are actually a class of drugs known as selective estrogen receptor modulators, which sometimes can do that job. So I've chosen one of those called tibolone for the moment to try and get the benefit to help me wean down from the estrogen without actually stimulating the breast tissue as much at this stage. Unfortunately, there's still evidence to suggest that tibolone shouldn't be used in people who've had breast cancer because it can increase your risk of a recurrence. That's just in the research that I've done to this point, but I'll dive a bit deeper into that because, obviously I've got a lot of patients who are in this situation as well. So up to this point, any kind of menopausal hormone therapy is generally not recommended. See, word substitutions. Oh, it's weird. This is what's happening to my brain right now. But yes, any kind of menopausal hormone treatment is not recommended after breast cancer, and that includes selective estrogen receptor modulators like tibolone. But I'd like to take a deeper dive into the evidence around that and see if it's any different for particular subtypes of breast cancers or anything like that. So I will definitely report back in if I find out any good information. You can be certain of that. But for now, just to let you know, 3 weeks on, yes, main issues I've had, not so much the flushes and sweats, although they can be really bad when I first wake up in the wee small hours of the morning. I do definitely throw off the covers and lie gasping on the bed like a starfish trying to cool down, as my partner will testify. But yeah, not so much the flushes and sweats. During the day, I'm not getting flushes. It's just this woolly headedness, the fact that, I can't string words together very well or think very clearly. I feel like I'm operating with a hangover all the time. It sort of varies between mild, dull headaches and like cracking migraines at the moment. So I'm having to use a lot of Panadol and even some migraine tablets from time to time to help with that. So yeah, it's not awesome coming off hormonal treatment, especially when you've been on fairly high dose for a long time. I do sympathise with any of you who've had to do this, but believe me, I'll be working through my range of options to try and help, and it can only be a good thing for me to learn more, even more about this, to be able to help our patients as well.